Hi, it's Dr. Maria Malik, and I shall be presenting Policy Paper 2 on development of a national action plan on antimicrobial resistance in Pakistan. So, antimicrobial resistance is a global health and a development threat, and it normally occurs when the microbes change over time and no longer respond to medicines, and thus making infections harder to treat, increasing the risk of disease spread, severe illness, and death. According to WHO, by 2050, AMR may lead to 10 million deaths per year, and you can see the distribution in different WHO regions in the map. For the same period, according to World Bank, there is going to be a reduction of 2 to 3.5% in GDP, costing the world up to $100 trillion. If you look at the SDGs, AMR threats 7 out of 17 goals. Pakistan is the fifth most populous country in the world and which is expected to rise to fourth place by 2050. If not addressed promptly, AMR may result in a health emergency with ramifications for the country's health system and economy. Therefore, there is an urgent need to develop a national plan of action on AMR in Pakistan in order to tackle the growing problem of resistance to antibiotics and other antimicrobial medicines in the country. So, antimicrobial resistance was detected in the early 1970s globally, and the first World Health Assembly resolution to promote the judicious medication use, including antibiotics, was approved in 1984. And in Pakistan, AMR has been recognized as a national concern since 2014. I shall be briefly highlighting the situation analysis of AMR in the country. Pakistan has one of the highest number of drug prescribed, where more than 3 drugs per patient are being prescribed, and out of which 70% are antibiotics. Self-medication is more than in 50% of the population. Availability of the over-the-counter medication, and especially antibiotics without prescription, is common. There is high prevalence of methicillin-resistant staph aureus infections in the hospitalized cases. The multi-drug resistant tuberculosis cases are also very high and constitute 5% of the total, and the recent trends in malaria suggest the same pattern. There is a documented indiscriminate and extensive use of antibiotics in farm animals in the country, and despite the extensive usage, there is no surveillance program. The infection prevention control is hindered by improper antibiotic usage and hygiene practices, and there is a dearth of coordination between human health and other sectors such as veterinary and agriculture sectors to manage AMR. Other important issue is lack of data on consumption, on quality of antibiotics and vaccines. An additional obstacle, it includes the lack of AMR laws, the incorporation of AMR into human and veterinary medical curricula, the absence of the infection prevention control programs, and a poor network of referral labs. The two alternative policies which have been selected, one is the WHO Global Action Plan on Antimicrobial Resistance, which was adopted by World Health Assembly in May 2015 in response to the AMR crisis, and it outlines 5 strategic goals. And the second one is the Kenyan National Action Plan on Prevention and Containment of Antimicrobial Resistance, and it was developed to prevent the spread of AMR in Kenya and the rest of the globe. And this action plan, it describes the roles and responsibilities of AMR stakeholders and urges on everyone to act immediately. So few of the recommendations which are going to form the basis of the development of the National Action Plan in Pakistan include establishing multi-sectoral and multidisciplinary coordination structures, strengthening the national surveillance systems by analyzing and reporting data, improving infection control and prevention by reducing the hospital-acquired infections, strengthening surveillance and increasing monitoring in the food animal business by establishing integrated system for antibiotic resistance, and not to forget about the estimation of the health and economic impact of AMR in public health research programs. So I conclude by saying that there is a danger that the world is going into a post-antibiotic age in which ordinary diseases might once again be fatal unless coordinated global action is taken. Therefore, there's an urgent need to develop national capacities to address these issues. I thank you all.